Hello. Today, the topic that Kelvin will discuss is one of the topics that I pay a lot more attention than the other topics in GI, and it's liver cancer. Liver cancer is definitely affecting a lot of lives because it's a cancer, right? However, though, from my field, there are a lot of conditions that can lead to liver cancer. So the first question is, what causes liver cancer? So you can think about the one way of cause that can cause liver cancer is having chronic inflammation of the liver and through a process of hepatitis, as you can imagine. So when you have chronic hepatitis, eventually that could lead to cirrhosis, and with that would put you at risk for develop liver cancer down the road. Causes for chronic hepatitis could include viral hepatitis, for example, hepatitis B, hepatitis C. It could be from alcohol use. It could be from fatty liver, which is very common nowadays. But there are some other conditions that can lead to that too. There are some other liver diseases that Kelvin actually never talk about, but I would bring it up today for the first time. For example, there is a condition that we call PSC, which is primary sclerosing cholangitis. And there's another one, it's called PBC, which is primary biliary cholangitis. There is another one called AIH, or autoimmune hepatitis, also very common, especially in the female, middle-aged female patients. So there are many liver diseases that can lead to a chronic inflammation of the liver, and eventually that will lead to cirrhosis. And the term cirrhosis means that the liver now are completely scarred down, so there is no normal tissue of liver anymore. At this point, it's just scar tissue of fibrosis, and the liver is not working anymore. So that is one way of developing liver cancer. Now, there is another process that can lead to liver cancer. Basically, if you have any changes of the DNA of the liver cells that eventually, because of the change in the DNA, that would lead to, that put the liver at risk of developing cancer. What can cause the change of DNA? Well, the most common one is hepatitis B. Hepatitis B has the ability of integrating the DNA of the virus into our liver cell DNA, and eventually would change the DNA of the cells and put you at risk for having liver cancer. There is another common one, well, not too common, but also common in some countries, that is called aflatoxin. So aflatoxin is a type of toxin that is produced by mold that you see in nuts and grains. For example, sometimes when you eat peanuts, did you notice some peanuts has this like whitish part on the peanut? So it's actually caused by a type of mold, and some of these molds potentially can produce aflatoxin, and the aflatoxin can alter DNA of the liver cells and lead to liver cancer. Sounds very scary, right? So that's why maybe it's just a professional concern that sometimes when Kelvin eat peanut, I have a tendency of looking at the peanuts and just pick out the one that do not have that, that whitish discoloration on the peanut. So it's just like one of the scare that, probably because I'm reading too much about it, and so that's why it scares me. Now, so those are the causes that potentially lead to liver cancer. What are the symptoms when people have liver cancer, right? So the symptoms include losing weight. Some people have skin turning yellow, eyes turning yellow. Some would develop abdominal pain, especially if the tumor is actually big enough that pushing onto the outside of the liver. It's just keep in mind that there is no nerve cells within the liver, so you don't feel pain when it comes to the mass compression from the tumor itself. So you only develop pain when the tumor pressing onto the outside where the nerve cells are actually located. Some other symptoms, itching, pruritus, that's the medical term for it, also very common as well. So what it means is that you increase some of the toxins, basically you can think it that way, build up and eventually release into your skin and causing the whole cascade and eventually lead to itching. And so I can give you one personal story. I used to have a friend who was also a pre-med actually at UC Irvine. We took, I think, 1 or 2 classes together at least. And then I didn't hear from him for a while. And then when I was a first year medical student at UCLA, I got the opportunity to work in Dr. Myron Tong clinic. That was a Wednesday morning, and the reason I know it's a Wednesday morning because he only has an Asian liver patient clinic on Wednesday morning. And I walked in, and there he is, my friend who was my pre-med student at UCI at that time, and he came in because he was developing itching. And when we did the workup, he had hepatitis B, and eventually when we did the whole workup, he actually got a 12 centimeter mass in the liver. And so basically hepatitis B not treated or not even diagnosed at all. And by the time that he got the symptom, which is itching, it's already causing liver cancer, and he actually passed within a year. That was a really sad story, and that also told me something. With hepatitis B, you can develop liver cancer at any stage, at any age. It doesn't have to be an older population that would be suffering from hepatitis B for a long time. So you can actually have Hep B, and just within 10 years or 20 years of life, you can develop liver cancer, which is very scary. And so so those are kind of the common symptoms that people tend to develop, but many times it's actually a very silent disease. You don't know until you do some form of imaging studies, and that's the reason why the American Association of Liver Disease recommends that for patients with hepatitis B, you need to do ultrasound and technically blood tests as well every 6 to 12 months, especially for Asian men after 40 and for Asian female after 50 for that reason, because the risk for having complication for hepatitis B can occur at a younger age, and you don't have to wait until developing cirrhosis in order to develop liver cancer. Now let's briefly talk about treatment for liver cancer. So the first step is you need to make a diagnosis first, and usually it's through some form of imaging. The imaging studies are so good nowadays, you actually don't even need a liver biopsy to diagnose someone with liver cancer. There are different CT scans, different MRIs that you can order in order to diagnose someone with mass in the liver, and eventually you can diagnose with liver cancer. Now, once you make a diagnosis, the next step is how many tumors are there? How big are they? Are they involved with any organs in the surrounding area? For example, is the tumor actually inside the vasculature in the blood vessels? Or the cancer already spreading to some other organs? For example, to the wall of your belly, to the stomach, to the lungs. If that's the case, then that will be stage 4. Depending on how many tumors are there, depending on the size of the tumor, that would dictate the next step of the treatment. So one modality for something small, for example, if you have a small tumor, you can do what we call RFA, which is a radio frequency ablation. What it means is that, and usually I explain to the patient, it's like you have this tiny device, and it's like a microwave kind of a probe that can go in there, and when it's get close to the tumor, and it can zap the tumor, and you hope that you can burn the tumor that way. So that is for small tumor. We're talking about usually something less than, I would say, less than 3 centimeter. That is probably an okay to go for that modality. And the advantage is you can zap it multiple areas, right? So you can have some smaller tumors in different areas and in the liver, and you can and zap it that way. Now, if you have a little bit something bigger, then you can try another technique we call TACE, which is TACE. So it transarterial chemoembolization. What it means is that the interventional radiologist has the ability of they can locate which vessel, which artery that would feed into that tumor, and when you get close to that tumor within that artery, you can introduce a drug like a chemo drug that hopefully by cutting off the blood supply, but also you want to use the chemo drug to kill off the tumor that way. So that's another technique. And then, of course, resection of the tumor is always on the table. And then in some patients, if you actually met certain criteria, one of them that we use in my field is called the Milan criteria, for example, then you can be qualified for liver transplant. We completely remove the liver with the tumors in it and replace it with a new liver. So that is another way. And then last but not least, if the tumors is bigger, in multiple places, that those resection or transplant or RFA or TACE are not applicable, you can do chemotherapy. There is a Y90, which is another technique that the interventional radiologist can apply as well, which is another form of chemo, but you introduce to the a bigger area that would involve with the liver tumor. So you can do systemic chemotherapy, or you can do that Y90 that I just mentioned. So, and there are newer drugs now that we can use for liver cancer in terms of chemotherapy. So, and that's kind of belonging to the oncology field that, when it gets to that point, Kelvin would refer the patient to oncology so they can take care of it. And that's kind of give you the gist of from all the causes, from the symptoms, as well as the treatment plan for someone with liver cancer. I hope that you can see that how passionate I am about this, because I think it's such a big decision when you diagnose someone with liver cancer and what you can do, because it would come with mortality rate that would come with how much life left for these patients. So Kelvin take this very serious. We usually do what we call a tumor board, where the radiation oncologist, the interventional radiologist, the hepatologist, the radiologist all sit together and decide and the medical oncologist, we all sit together and decide what modalities that we can use for these patients. And so it's a very integrated multidisciplinary approach when it comes to liver cancer. And I hope you learned something from this topic. And so, it's Mother Day weekend, so I hope by bringing this up to you, you not just learning about it, but also enjoying your day today with your mom, with your family. I do believe in family quality time, because I think it's very important. And so enjoy that and take advantage of the day. And ciao, and see you next time. All right, you guys have been watching my YouTube channel of Dr. Kelvin Nguyen. If you really love what you're seeing, please subscribe to my channel. You can do it for me, or you can do it for the duck in the background. They would love it too. See you next time.